We're now going to discuss some infections of the joints and the bones, the osteomyelitis and septic arthritis. Usually these are caused by the same organisms. Osteomyelitis, the number one cause is bacterial. It's going to be Staph aureus. You got to know that. There are other circumstances where other germs may be more common, but you should always cover for staph when you are treating the patient. So the most common overall is Staph aureus. In the neonate, think of group B strep, same cause of sepsis meningitis in the neonate can cause osteomyelitis. If they discuss a puncture wound, for example, if you're wearing sneakers, they say that the child is wearing sneakers, stepped on a rusty nail or whatever, think of Pseudomonas. The Pseudomonas actually lives in the foam cushion of the shoe. And when you step on the nail will pick up the Pseudomonas and inoculate it into the child's foot. With sickle cell, always think of Salmonella. Salmonella and Staph aureus are probably neck and neck there as being the most common cause in a patient with sickle cell. So remember to always cover the patient with something that kills Staph aureus as far as antibiotics are concerned. Septic arthritis is most commonly caused by Staph aureus. That's the first thing you're going to think of. That's the second thing you're going to think of. That's the third thing you're going to think of. In children, osteomyelitis is many times hematogenous spread. With osteomyelitis, they can have pain on movement in the infant. An older child will complain of fever, maybe some pain. Look for the cardinal signs of inflammation. So they'll have pain, redness, swelling, and it'll be hot. And as many times they can limp or actually refuse to bear weight. This can happen with either septic arthritis or osteomyelitis. You are going to get a blood culture. You are also going to get a CBC. The SED rate will be elevated, and so will the CRP. The CRP is useful for infections too, and it'll be elevated. The first step as far as radiographic studies is going to be an X-ray. You want to make sure that A, it's not a fracture. With osteomyelitis, it may be normal. Remember that the X-ray may be normal in the first 1 to 2 weeks with osteomyelitis. In a child that has septic arthritis, you may see an effusion in the joint, in which case, if you see an effusion and you think it's septic arthritis, the next step is to do an ultrasound and you aspirate the joint, do an arthrocentesis. If the ultrasound, if there's no effusion, the X-ray looks normal, you're still thinking of osteomyelitis, the best test would be an MRI. And that would give you the diagnosis of osteomyelitis. Remember that a negative X-ray in the first week or two does not rule out osteomyelitis. It takes that long to see the cortical elevation and periosteal elevation. The definitive is going to be an aspiration arthrocentesis for septic arthritis, and the definitive is going to be a bone culture actually for osteomyelitis. The treatment for both of them is going to be antibiotics for a good 4 weeks minimum, and always cover for staph.